Hi everyone, welcome back. Today in this video, I'm going to help you to understand the OET writing module in just 6 minutes. Yes, only 6 minutes. So if you are confused about your OET writing module or if you are not sure what the examiners actually needs, just stay with me. By the end of this video, you will understand the structure, scoring, the letter format, language tips and how to write a proper OET letter. Let's begin. First, what is OET writing? In OET writing, you need to write one profession-specific letter, usually a referral, discharge, transfer or an advice letter. For that, you will get 5 minutes to read the case notes, 40 minutes to write the letter. And what is your task? Select only the relevant information, organize it logically and communicate clearly for a healthcare reader. Now, let's see the scoring criteria. The examiners will assess your letter using 6 criteria. The first one is purpose. That is, what is actually the purpose of your letter should be there in the beginning. And second is content. That is, you have to include all the relevant and appropriate details. The third one is conciseness and clarity, where you have to avoid all the irrelevant informations. And the fourth one is genre and style. That is your tone professional and formal. And the fifth one is organizational layout, where you have to organize your letter professionally. The last one is language, which include your grammar, vocabulary, spelling and punctuation. If you need to get a grade B, then your letter should be clear, accurate and professional. That's it. Now, let's see the perfect structure for all OET writing. Here, I'll give you a gold standard structure which can be useful for most of the writing tasks. For that, we need a purpose paragraph first. It should contain why you are actually writing the letter. For example, I am referring Mrs. Helen Brown, who requires further management of uncontrolled hypertension. Then comes the body paragraph, which is the most important part in your letter. You have to organize your body paragraph logically, that is, current condition or reason for referral, relevant medical history, recent changes, treatments, investigations, social or lifestyle factors relevant to the reader. And finally comes the recommendation paragraph, that is what the reader wants to do for the patient. Let's see an example. Kindly continue monitoring her blood pressure and adjust medications as required. So by this recommendation paragraph, you can close your letter professionally. Now let's see how to select the most relevant information. Your case note contains a lot of information. It is your job to pick up only the needed points which is relevant to the reader. That is, if the information helps the receiving healthcare professional continue care, then include it. If not, leave it out. And now I'll give you some language tips in order to score B or A. You have to use professional tone. For example, she presented with, he was comments tone, she requires ongoing monitoring. You have to avoid informal phrases. Examples include, she has a problem with, he is not doing good. Use linking words like, additionally, however, therefore, subsequently. Your grammar focus should be, use past tense for past events, use present tense for current condition, avoid overusing pronouns, that is, you have to keep the clarity. And finally, let's see some common mistakes that you have to avoid while writing your letter. First, writing everything instead of selecting. Second, not stating the purpose clearly at the start. Third, mixing irrelevant social details. Fourth, writing long, unclear sentences. Fifth, using non-professional language. And the last one, sixth, forgetting the request in the last paragraph. So if you avoid all these mistakes, then your score will immediately improve. That's it. I hope this video will help you in your upcoming exam. Thank you for watching.